Good evening. I'm Andrew Waterhouse, Director of the Robert Mondavi Institute for Wine and Food Science at UC Davis. Tonight's event is part of the Savor Lectures on Food and Wine series, which we co-present with the UC Davis Library. Now in its second year, Savor pairs UC Davis experts with leading policymakers and entrepreneurs for discussions on the biggest topics in food and beverages being studied at UC Davis today. Tonight's event on the science and politics of sugar-sweetened beverages is certainly no exception. We are honored to have UC Davis Chancellor Gary May with us this evening to open our program. Chancellor May is a highly engaged leader with a passion for helping others succeed. He believes in success is best judged by how we enhance the lives of others. Throughout his career, he's championed diversity, equity, and inclusion, and has developed nationally recognized programs that support underrepresented groups in science, technology, engineering, and math. In 2015, President Obama honored him with the Presidential Award for Excellence in STEM Mentoring. He was inducted into the National Academy of Engineering in 2018, and last month he was elected to the American Academy of Arts and Sciences. His vision as UC Davis's 7th Chancellor is to lead the university to new heights in academic excellence, inclusion, public service, and upward mobility for students from all backgrounds. Tonight's panel demonstrates that public service mission by engaging the public in an important food policy discussion. Welcome, Chancellor May.
Thank you, Andy. On behalf of UC Davis, welcome. This evening we'll be talking about soda, its associated health risks, and how soda came to be at the heart of a political fight in California. The soda industry generates about $38 billion each year in annual revenue. Those numbers make it clear that the public loves its soda, but the amount of soda Americans drink is a concern for many public health officials. Some research shows that Americans consume nearly 40 gallons of sugar-sweetened beverages per capita per year. We're joined today by Jennifer Falby. She's a faculty member in the UC Davis Department of Human Ecology, who's investigated the potentially addictive properties of soda. She's also led a study on the nation's first soda tax in Berkeley. The tax was intended to reduce soda consumption and generate public awareness of the health risks associated with drinking it. But big soda has pushed back. According to the Los Angeles Times, the soda industry has spent about $12 million fighting proposed soda taxes in California over the last 3 years. Assemblymember Richard Bloom also joins us today. He's been at the front lines of the fight against big soda by introducing legislation that would tax soda distributors in California. In turn, the tax would bring awareness to the state's obesity and diabetes issues and use the revenues to fund public health programs. So how's the fight against big soda playing out? And what impact has it had on consumption, especially with a public that may be hooked on soda? These are some of the key issues being discussed today. I'd like to thank the Robert Mondavi Institute for Wine and Food Science and the UC Davis Library for organizing this timely event. I'd also like to thank our panelists for taking the time to be here and drive the discussion. Take care, everyone. Thank you.
Thank you, Chancellor, for that warm welcome. And now I'd like to turn it over to my colleague and co-host, University Librarian and Vice Provost of Digital Scholarship, Mackenzie Smith. The UC Davis Library has one of the premier collections on food and wine worldwide. And under Smith's leadership, it has innovated new ways to connect the public with this scholarship. From interactive digital platforms to experiences like this evening's virtual program, the library has been at the forefront. She will moderate tonight's lecture and discussion.
The UC Davis Library is proud to co-present the Savor series as part of our mission to support access to and the impact of research being done here at UC Davis. I know we're all eager to dive into the meat of tonight's discussion, but first, a brief reminder that if you have questions as you listen to our speakers' presentations, you can use the Q&A button at the bottom of your screen to submit your questions at any time. Our panelists will answer as many as possible during the Q&A period at the end. And with that, our first speaker tonight is Jennifer Falby. As Chancellor May told you, she is an assistant professor in UC Davis Department of Human Ecology. Her research focuses on how public policies and programs can improve public health. She has studied the effectiveness of local soda taxes in Berkeley, Philadelphia, and elsewhere in reducing consumption of sugary beverages, and conducted exploratory research on the potentially addictive properties of sugar-sweetened beverages among teens. She's also examined soda marketing and evaluated strategies to counter it. We are delighted to have Professor Falvey here with us today. Jen, welcome.
Thank you, and it's a pleasure to be here with you this evening. And tonight we're going to talk about the health consequences of America's sugary drink habit, also why it is that Americans drink so much sugar, and then we're going to talk about sugary drink taxation as a method to improve public health and advance health equity. So first we're going to talk about health, and I'm going to use the terms sugar-sweetened beverages, SSBs, and sugary drinks interchangeably to refer to this set of beverages here, which all contain sugar that's added to them. And these drinks confer a higher risk of chronic disease and also drive mortality. Worldwide, these beverages are responsible for 184,000 deaths per year, and in the US, 52,000 deaths per year. Sugary drinks are uniquely harmful to health for a number of reasons. First, they're the #1 source of added sugar in our diets, and this is a source of empty calories. And for adolescents in particular, sugary drinks are the single largest source of calories. Liquid sugar is also not as satiating or satisfying as is consuming solid food, even solid sugar, and that can lead us to overconsume calories. And there's strong causal evidence that sugary drinks lead to obesity, and consuming just 1 to 2 sugary drinks per day increases risk of type 2 diabetes by 26%. Furthermore, these beverages contribute to risks of heart disease and tooth decay. So focusing on obesity here, which is one of the major consequences of sugary drink consumption, it is right up there together with tobacco as a leading cause of premature death. And year after year after year, the prevalence of obesity continues to climb in this country to the point where 42% of adults are considered obese and 72% are considered overweight or obese. Furthermore, like so many other health issues, we see really troubling health inequities with obesity, with higher prevalences among lower income individuals, as well as certain racial and ethnic groups. For instance, Black and Hispanic Americans have a higher prevalence of obesity than other groups. And there's scientific consensus that the obesity epidemic has not been driven by a sudden change in our genetics or our willpower. Instead, it's been driven by recent changes in the food and physical activity environments, as well as the social environments. And these changes have been differentially distributed across the population. It's oftentimes individuals and communities that are disadvantaged that are exposed to more advertising for unhealthy products, that lack access to physical activity spaces, and that lack access to cheap and affordable foods. These issues, together with inequitable access to healthcare, has been driving these health disparities. And obesity is a major risk factor for type 2 diabetes. And we're at the point now where overall there's a 1 in 3 lifetime chance of getting type 2 diabetes in our lifetimes. And this prevalence, this risk is even higher among Black and Hispanic Americans. And obesity and diabetes are concerning conditions in and of their own right, but there's growing evidence that they also confer higher risks for more severe COVID-19 illness, further exacerbating existing disparities. And despite these health consequences, sugary drink consumption is high in the US, with the majority of children and about half of adults consuming these beverages daily. And you may have heard the phrase, everything in moderation, but what does moderation mean for sugary drinks? Let's have a look. How much added sugar should we be consuming in our diets? And added sugar is sugar that's added to foods and beverages and not sugar that naturally exists. According to the American Heart Association, men should consume no more than 9 teaspoons of added sugar in a day, and women and children should consume no more than 6 teaspoons of added sugar. So how do sugary drinks measure up? So if we look at just one 20-ounce bottle or can of common brands of sugar-sweetened beverages, all of these would exceed the daily added sugar limit set by the American Heart Association. And remember that this limit is not just for beverages, it's for the total amount of added sugar in our diet. So even 1 per day can increase health risks. Now, why is it that we drink so many sugar-sweetened beverages? Well, we don't make decisions in a vacuum. The decision making that we make is heavily influenced by our environments. And one thing that's changed over time is portion sizes. In the 1950s, a big 16-ounce size advertised here could serve 3 people. Today, a 20-ounce bottle is now considered a single serving size. Sugary drinks have gotten cheaper while obesity rates have increased, as you can see here. And the price of fruits and vegetables has gone up. Then there's marketing. Sugary drinks are advertised to the public, and close to $1 billion is spent every year advertising these drinks. And that's more than 4 times the amount of money that's spent advertising water and 100% juice. And marketing takes the form of TV ads, outdoor billboards, celebrity endorsements, and professional athlete endorsements. And oftentimes these products are advertised in conjunction with sports or physical activity, which confer health benefits. So this can send a confusing message. Then there's product placements. For those of you who subscribe to Netflix, you might think you're paying a monthly fee to not have to see any advertising. If any of you saw the show Stranger Things, you might have noticed that there was a lot of product placement. In fact, Coke got 20 minutes of screen time in season 3. Then there's Advergames. This is an example of an Advergame promoting Gatorade, which is sold by Pepsi. And in the game, it says, keep your performance level high by avoiding water. The company had to pay the state of California $300,000 to settle a lawsuit about misleading claims. And then there's social media. Celebrities and influencers receive money to promote products in their feeds. And oftentimes it's not super clear that these are paid promotions as opposed to just photos that are being posted. And when you go to get a drink from a vending machine or a dispenser, even if you're going to get a bottled water or some other unsweetened drink, typically the logo that you see is a logo for a sugary drink. When you go to a grocery store, you might think that you can avoid temptation by not going down the beverage aisle. But there are contracts between manufacturers and supermarkets that dictate where products are located in a store and how they're advertised. So even if you avoid the beverage aisle, you're likely to be exposed to some kind of standalone display for sugary drinks, maybe along with a sale, as well as these end cap displays here, which are at the end of the aisle. And then before you check out, you're likely to see sugary drinks yet again. And this is referred to as 360-degree marketing. And what we are also seeing is that marketing of sugary drinks is targeted, and there's disproportionate exposure to marketing for these beverages by certain communities. And the Red Center issued a report that found that Black youth saw 2 times the number of sugary drink ads as white youth did. And researchers, including my colleagues here at UCDAVIS, Diana Cassidy and Lisa Miller, have done research that has shown that sugary drink ads are concentrated in low-income, multiracial, and Black neighborhoods. So this type of targeted marketing is further contributing to health disparities. Then there's the products themselves. The chief ingredients are sugar and caffeine. We know caffeine has addictive properties, and there's growing evidence that sugar does as well. In an exploratory study, we enrolled 25 teens who were high consumers of sugary drinks, and we had them go through a 3-day period where they were to drink nothing but water and milk. During that period, the teens exhibited increases in symptoms of withdrawal like headache and decreased motivation. They also experienced cravings for sugary drinks and a decreased feeling of overall well-being. So now that we've talked about the health consequences of sugary drinks and why it is that we drink so much, I'm going to talk about an important public health strategy that has emerged, and that's taxing sugary drinks. Advocates for sugary drink taxes say that taxing the sugary drink industry is one way to hold the industry accountable for the healthcare and human costs that their products generate. Another argument in favor of this policy is that these taxes can provide much needed funding for public health. And it should be evident now more than ever the importance of public health infrastructure, yet funding over the past couple decades has dropped to the point where we spend only 2.7% of total health expenditures on public health. Sugary drink taxes are a policy that's supported by the American Heart Association, the Cancer Society, and World Health Organization, as well as several other organizations. And so how do these taxes work? Sugary drink taxes are excise taxes typically, which beverage distributors or manufacturers pay to local governments, or in some cases countries. And the tax in the US at least is typically 1 to 2 cents per ounce, and it's paid on distribution or sales of sugary drinks to restaurants and stores, which include these categories here. And milk, 100% juice, medical beverages, and alcoholic drinks are exempt. This shows you where the taxes exist around the world. There's more than 40 countries that have implemented such taxes. And Berkeley is where my research began on the topic, and it's also the first city in the country to implement a sugary drink tax. The tax passed with 76% of the vote. And this is what the campaign looked like. It was supported by a broad coalition that included parents, teachers, health professionals, and leaders from the Black and Latinx communities. Lawn signs in favor of the tax were everywhere, and there was even some pro-tax graffiti covering up some anti-tax ads. And what we sought to do with our research is to evaluate the impact of the tax on consumption of sugary drinks, and to focus in particular on populations in Berkeley that are at highest risk for chronic disease. So we conducted this research in lower income neighborhoods that were racially and ethnically diverse. And we matched those Berkeley neighborhoods to neighborhoods in nearby Oakland and San Francisco, which didn't have a tax at the time. What we found is immediately after the tax was implemented, consumption of sugary drinks dropped by 21% in Berkeley. And in the longer term, 3 years after the tax, this drop was 52% in Berkeley, compared to pretty much no change in the other cities. And what we saw is that water consumption increased, which is exactly the type of change we hope to see. These are the other cities in the US that have also implemented sugary drink taxes. And from looking at the pro-tax campaigns, a lot of times the health consequences of sugary drinks are highlighted. So these campaigns and the media coverage that they elicit can serve as a type of public health campaign in and of themselves. Furthermore, these taxes can result in changes in the beverage environment that help people make the healthy choice. This is an example of a dollar store in Berkeley where there used to be soda sold at checkout, and that was replaced with bottled water. Other jurisdictions that have implemented sugary drink taxes are seeing really similar results to Berkeley, where consumption of sugary drinks has declined or sales of these beverages. In Mexico, there was a 10% drop, Philadelphia, 38%, Seattle, 20%, and Catalonia, 39%. And another key way that these taxes influence public health is by providing funding for programs, including programs that promote health equity. In Berkeley, Healthy Black Families has been able to deliver nutrition education and make water more available in the Black community. The Public Schools Cooking and Gardening program provides nutrition education to all students in the district, regardless of income. Water filling stations have been able to be installed in Oakland public schools. And in San Francisco, Healthy Retail program has been funded that makes fruits and vegetables available in food deserts and food swamps. And in Philadelphia, the vast majority of their revenues from their tax have been used to fund universal pre-K, allowing over 2,000 students to get access to preschool, which is a really key social determinant of health. In Seattle, revenues have been used to fund an emergency grocery voucher program during the COVID-19 pandemic. And so all in all, the evidence shows that sugar-sweetened beverage taxation is an effective policy that can help promote public health as well as advance health equity. So thank you so much. And I'm now going to pass it back to Mackenzie.
Thank you, Jen, for your analysis of the public health issues and effectiveness of local tax ordinances. And now we're going to turn our attention to what's happening at the state level. Assemblymember Richard Bloom has been on the front lines of California's political fight against the soda industry ever since he introduced a statewide soda tax in 2015. Although Big Soda has fought back hard to thwart the passage of such legislation, and he'll share that story with you, Bloom has remained a leader on the issue, and we thank him for not giving up on the fight. Bloom has represented Western Los Angeles County in the California State Assembly since 2012 and served 3 terms as mayor of Santa Monica. Assemblymember Richard Bloom, welcome. Take it over.
Thank you. Good evening, everyone, and I appreciate the introduction, Mackenzie. Thank you to Chancellor May, the UCDAVIS Library, and the Mondavi Institute for putting on these important lecture programs. Jan, I appreciate all the data. A lot of it I've heard before, but it never ceases to amaze me just how strong the evidence is and how little progress we've been able to make on this issue. And as Mackenzie noted in her introduction, I've been working on enacting a statewide soda tax for about 5 years. And let me tell you that waging a war against sugar is not easy. It sometimes feels like I'm waging a war against Mickey Mouse or some other household name. Processed sugar in this country is considered a staple, and Coca-Cola is a household name. It's a brand that has instantaneous global recognition, and that's nowhere is it more true than right here in the United States. And you could say the same thing for the branding of Pepsi and Dr. Pepper. These are brands that stand out, that have been the subject of billions of dollars of advertising over the years, and they're very, very recognizable. Big Soda, as we call it, has woven itself into the fabric of the American story, and we're seeing the consequences. When we go to a ball game, it's a hot dog and soda. Go to the movies, it's popcorn and a soda. Celebrate the end of soccer season with your kids, it's a pizza party and soda. When we dine out, especially when we go for fast food, we get a sandwich, a burger, a burrito, whatever it is, and a soda with unlimited free refills. What's that trying to encourage? We know that overconsumption of sugar leads to illness, and we can't even get the industry to cut back on the quantity by which it markets itself. You'll see in stores now that there are 8-ounce cans, and I know people who will just pick up 2 of those and drink 2 8-ounce cans. So now you've got a 16-ounce drink instead of an 8-ounce drink. But even at 8 ounces, we know that the amount of sugar that is in a can of soda, as Jen explained, is beyond the daily minimum. Now, when we get into discussions with soda companies, or they come to Sacramento for hearings, they will say that this is an occasional snack. It's not intended to be something that's consumed every day, but that's not the way it's marketed. It's marketed as something that you're going to want every day. And they're viewed as wholesome, sugary beverages are. There was never a temperance movement against sugar or soda, and you don't have to be 18 or 21 to buy one. The industry spreads money in low-income neighborhoods, in churches, in other places in our communities, and it focuses a tremendous amount of advertising, as was mentioned, in ethnic neighborhoods. And our brains love soda. When you start drinking sugar in its liquid form, you begin to crave it pretty quickly. It doesn't take long to develop that dependence. And So placing a sin tax or just a tax on sugar-sweetened beverages is frankly not a popular idea. People have to be convinced why this is important. And we've got the soda industry. And when I say soda industry, we are not just talking about the distributors and the manufacturers of soda. We are talking about the stores, the retailers, the chambers of commerce in our communities, the Teamsters Union that feels for some reason like they won't have enough things to truck around if we tax soda, which is simply not accurate. But this is a very strong coalition that is aligned against us in this fight. Processed sugar is considered to be the hero, not the villain in the minds of many. And so that there's a great challenge ahead of us for passing a soda tax. We really have to change the perception that sugar and soda are harmless and implement broad behavior change for the sake of our collective health and well-being. And we see in the current crisis how important it is to focus on the collective health. But even if we look at the health of individuals, when you saw the statistics that Jen was sharing with us, if you took 3 random individuals, including yourself as one of the 3 people, look to your right and look to your left, and one of you is going to be obese statistically. So this is not an issue that is not front and center before us. We just have to be able to actually see it and not look past it. The legislation that I've been working on for the past 5 years proposes a 2 cents per fluid ounce tax on sugar-sweetened beverages. And while that might sound like a small amount of money, in the aggregate in California, that would generate $2 to $3 billion, with a B, $billion in revenue for the state. Similar to taxes placed on alcohol, tobacco, and gasoline, the sugar-sweetened beverage tax is an excise tax, which means it's not paid directly by the consumer, it's paid by the producer. And the producer can choose to absorb that cost or to pass it on. But in order to mitigate their costs, producers will often choose to pass the cost along to the consumer, which does result in a price increase. And one of the beneficial effects of that price increase is that it tends to, of its own accord, depress consumption. That price increase is why sugar-sweetened beverage taxes are always labeled as regressive. The soda industry loves to press that point. The Chamber of Commerce is one of the worst offenders when it comes to that. And our argument is that if you want to think about regressive, then let's think about who is affected by diabetes, by obesity, by heart disease, by tooth decay. And it's our disadvantaged communities that suffer the brunt of this epidemic of obesity and diabetes and the associated other diseases. And there's no question about that. Let me just share with you the most recent article that is written that's relevant to this issue. It's called "The Black American Amputation Epidemic." The number of amputations in this country that are secondary to obesity and diabetes is astronomical, and it's primarily focused in our disadvantaged communities. And so how can one say that the cost of the soda tax is regressive? No, it's the effect of sugary beverages on our communities that is the regressivity that we should be worried about. The revenues that we would generate from the soda tax are proposed in my legislation to be put into something we call the California Community Health Fund, which would provide funding to state and local health agencies and departments, local governments, schools, community-based organizations to promote greater health equity and access. In other words, this money goes into a fund that is spent in our local communities as a counterweight to the billions of dollars that market these diseases, these sugary beverages that are leading to the diseases in our community. And by using these funds as a counterweight, we can, in addition to the depressed consumption that would exist because of the tax itself, we can actually talk to people about their health, and that will lead to better health outcomes in all of our communities. The legislation rather is structured to distribute the funds through competitive grants in order to ensure that they're being directed to the communities that have been most heavily impacted by the negative health outcomes of overconsumption of sugar. And the data reflects that socioeconomically disadvantaged communities of color continue to experience disproportionately high levels of obesity and type 2 diabetes, which then lead to an increased likelihood of heart disease, stroke, fatty liver disease, kidney failure, and a myriad of other health outcomes caused by these diseases, including eye damage, tooth decay, and, as I said, amputations. So we need to ensure that impacted communities and healthcare providers have the resources that they need to address these preventable diseases. And that's the real kicker here, as if you think about this, if we can cut back significantly on the consumption of sugar in our diets, then we can lower dramatically the amounts of these diseases. You know, more children today are obese than ever before. More children today are developing what we used to call adult onset diabetes. It is truly an epidemic in our communities. And as we continue the fight for a statewide soda tax, we're also striving to improve the concept and refine the bill and bring it current. So we could not have predicted 5 years ago when I started down the path of introducing legislation on this topic that we would have a crisis like the pandemic that we are currently experiencing. But one of the things that we've learned in this pandemic is that the people who are most at risk are seniors. But in addition to seniors, it is those who are obese and those who have diabetes, those who have respiratory disease. These are the things that, these are the conditions that have been created in their own epidemic fashion by the overconsumption of sugar. And so we're now thinking in the next iteration of this bill that we will allocate some of this funding, some of the revenue from the soda tax to addressing the COVID-19 or the next pandemic, because we know that this is not going to be the last one. But it is remarkable that many of the people who are affected today, and I think it's a cautionary tale that many of the people who are affected by COVID-19 also fall into these categories that put them at risk even if we didn't have a pandemic. So as the state responds to the COVID pandemic, we're going to try and make that change. But we know that the soda industry has, for many years, employed the very tactics that were used by the tobacco industry in avoiding addressing that issue. They deliberately target children and communities of color. They tell us that their products are safe and hire their own scientists to spin their points of view. They rebrand highly sugary drinks by selling them in smaller cans or calling them sports drinks. And they launch campaigns of misinformation to stop any efforts to address this issue. Well, fortunately, I'm not alone in this fight. We have a strong coalition. We have the American Heart Association, the Public Health Institute, the American Academy of Pediatrics, California Medical Association, American Diabetes Association, the Dental Association. The list goes on and on, but make no mistake about it, a soda tax, it's a war, and that's how the industry treats it. The battles have been tough at both the state and the local level, and most recently, the soda industry has been successful at defeating local ballot measures, and then they decided, after Berkeley won its battle back in 2014, it took them a few years, but last year they came up with a new strategy. And that strategy was to qualify a ballot measure that would have gone on the California ballot that would have made it impossible for any local city or county to pass any tax measure, because they would raise the threshold with which you would have to vote in order to pass that tax. And so they put that on the ballot, and this was the soda industry that did this. And why would they care about a school tax or a city tax to raise fees for local community needs? I'm not talking about soda taxes here, although soda taxes might have been that in that group of all taxes that might be considered. Well, after they qualified that tax for the ballot, they came to Sacramento and they said, if you in Sacramento pass a law that prohibits local jurisdictions from ever enacting a soda tax, then we will not move forward with our ballot measure that affects cities and local jurisdictions in such a larger draconian fashion. And so with a gun at the legislature, literally a gun at the legislature's heads, that legislation was passed a year ago, and now local jurisdictions can no longer pass soda taxes. It's outrageous. But it shows you just how fearful the industry is of the work that we're doing. And we're committed to not only changing that dynamic, hopefully we'll be able to change that law at some point in the future, but we're committed now more than ever to passing a statewide soda tax, because our local communities have nowhere else to turn but to their state government. And so we'll continue the work of passing a soda tax. This year it's not going to happen, but we're going to reintroduce the bill again in January. And if you're interested in joining the fight, just let me know. I'm easy to find in Sacramento or Santa Monica. Thanks for giving me the opportunity to talk to you a little bit about our efforts in Sacramento, and I'm looking forward to your questions.
Yeah, thank you, Richard. That was a very sobering presentation. And I'm sure we have quite a few questions for both of you. So let me turn now to the Q&A. We have about 20 minutes to take questions, and I'll try to describe the question and then ask one of you to
drink more water.
Drink more water. So our first question is really to clarify something you were talking about. When you talk about soda tax, how do diet sodas and other types of sweetened beverages fit into that? Are they taxed? What about sweetened drinks like hand-flavored coffee or tea, or sweetened coffee drinks served fresh like Starbucks, very popular? Could you just help us understand the scope of this?
Yeah, that's a great.
Yes, it's a little bit complicated, but
yeah. Let's start with Richard and then we'll go to you, Jen.
Okay.
Go
Jen,
for
if
it.
you want to explain it, that's fine.
Nope. Go ahead.
We set a threshold for a certain number of grams of sugar per ounce in a drink, and then there are drinks that are excluded, but it does include sports drinks, and it includes any drink that exceeds that threshold, but does not include milk. We made a political compromise and we excluded chocolate milk because we felt like people just couldn't live without their chocolate milk. By the way, this does not stop anybody from buying a soda. A lot of people who oppose the soda tax will say, you can't take my sugary beverages away from me. Well, we don't do that. We just add a fee that we then turn around and use for the public good. So there are some exclusions. I think Jen laid those out earlier. And did that answer the question?
What about diet soda? Is that
Diet soda is not included. There is emerging evidence. There have been a number of studies that have been done that indicate that diet soda is also problematic from a public health perspective. But most of those studies have concluded that more study is necessary before we can reach any definitive conclusion about that. So we also know that we've already picked a pretty big political battle just by going after sugary beverages. To go after the unsweetened beverages or the artificially sweetened beverages, it's been a tough battle to this point. We don't need to make it any tougher at this point.
one step at a time?
Yes.
Jen, do you have anything to add about how that is playing out in other parts of the country?
Oh, about which beverages are taxed?
Yeah.
Yeah, so in most US jurisdictions, it's very similar to what Richard mentioned, only beverages with added sugar, but Philadelphia is a notable example, a notable exception where artificially sweetened beverages are also taxed.
Okay, interesting. Okay, so next we have a pair of related questions. Is there data on how many people have reduced sugar intake or gone off sugar completely? And when they do that, what takes place? Do they eat more fat, drink more alcohol, caffeine? So what are the behavioral changes we see? And second, what are the health issues related to drinking diet soda? You just touched on that a little bit, Richard, but maybe there's more to say. So let's start with you, Jen.
Yeah, I don't know if anyone has actually studied individuals who've completely gone off added sugar, but we do know what happens when people reduce their consumption of sugary drinks as a result of public health campaigns like soda taxes. And people make a shift to water is what the evidence is showing. So that's a good shift. Another related issue about diet soda is interesting. There is some emerging evidence that diet soda or artificially sweetened beverages confer some health risks, but in experiments when people who were consuming sugary drinks then switch over to diet beverages, they do see improvements in some indicators of health. So there's sort of the harm reduction approach. I think ideally we'd want to be promoting unsweetened beverages and water.
Yeah, okay. Yes, I've seen some of the research on artificial sweeteners tricking your body into thinking they're sugar. So that is definitely an area.
And priming the brain to crave sugar and crave sweet things, and possibly leading an individual to consume sugary foods.
The gateway drug.
Right. I think there's an important point to be made here, and that is that we know based on the research that has been done that sugar in its liquid form is the unhealthiest form of sugar consumption. It is metabolized differently from everything else. And so that's why we focus on sugary beverages for the soda tax. But there is a larger health question about overconsumption of sugar. It's virtually impossible to go shopping today and avoid purchasing products that have added sugar. It's in everything. It's so important to look at the ingredient labels of the things that you buy, and you'll see the added sugar. It's right there on the nutritional label, and it's in everything we drink. And you don't escape it, just for example, because you might be vegan. A lot of vegan options out there have added sugar in them. So this is a transition in the American diet that has taken place over many, many years. And one of the values of the soda tax is that it, while yes, it is levied on sugary beverages, the money can be used to educate people on how to live a healthy life in a much, much larger sense. And that's one of the reasons why I feel it's very, very important to focus the expenditure plan on being spent in a local community setting, where the goal is to teach prevention, but prevention on a large scale, how to live a healthier life so that we live with less misery in our life, with less disease and longer lives.
Okay, one more kind of research and health related question before we turn to politics, and that is about types of sugar. So is there a difference between different kinds of sugar that you see in beverages like high fructose corn syrup versus cane sugar, which is promoted as slightly better? So is there any reality in that, or are they all the same?
In high concentrations, fructose might have some unique impacts metabolically, but what we see is that in countries where the dominant form of sugar in sugary drinks and other foods is coming from cane sugar, so for instance in Mexico, there is a huge obesity and type 2 diabetes epidemic. So there's not really a huge overall difference.
And the legislation doesn't differentiate between what kind of sugar it is.
Correct.
That's correct.
Right, okay. All right, then turning to another question. This one I think is for you, Richard. What are some of the key takeaways from the fight against big tobacco in the 20th century that may be applicable to what we're up against with big soda? And in what way do those two public health crises differ?
I'm sorry, what were the two?
Sorry, we're looking for analogies to the big tobacco battles of the 20th century and what lessons can be applied here and how these public health crises differ.
Well, I think the number one lesson is from tobacco, and that's an issue that I've been active on as well, particularly during my time as a council member in Santa Monica. We're in this for the long haul, and change is not going to happen overnight. It's already taken a long time, but the tobacco wars have lasted since the 50s, and they go on today with vaping,
right?
And with unique ways of marketing tobacco-based products. So I think the idea that this battle is not going to be over in the short term, and we have to stick with it, is extremely important. But I believe that the crisis, the healthcare crisis that's been brought on by overconsumption of sugar, is far more dramatic than that with tobacco. And over time, because remember, we have a lot of people who we know now are obese, and it is predictable, or who are pre-diabetic, have been diagnosed as pre-diabetic. And we know if we don't change the pathway of those individuals, they're going to become diabetic. The cost to society, healthcare costs are astronomical. We have an entire industry that is built around treating preventable diabetes. And, you know, God bless the people who have invented insulin pumps and new forms of insulin and other healthcare individuals. My father-in-law was a lifelong diabetic, and he benefited from some of those things in his life. But we can prevent these diseases. It was no walk in the park for my father-in-law to suffer through that disease for almost 70 years of his life. He was diagnosed at the age of 19. And if we could have prevented that for him, if he didn't have to become diabetic, then imagine how different his life would have been. And that's the real battle that we're fighting here.
Jen, do you have anything to add on the kind of PR and marketing side? Are they similar, or are we seeing differences?
They are quite similar. So as Richard mentioned, the preemption strategy of passing laws at the state level to prohibit local policies that tax sugary drinks. This is exactly what the tobacco and firearms industry has done. So they're quite similar.
Yeah, I'm not surprised. So
we do know that we're having an impact on the industry because diet drinks aren't called diet drinks anymore. They're called Coke no sugar or Pepsi no sugar, and they're marketed that way. The only reason that would be marketed that way is because there is an understanding in the industry that a large segment of the population understands that sugar is not good for you. The problem is, in addition to marketing Coke No Sugar, they're also marketing every week a new sports drink or another new product that has sugar in it. And so the industry will point to the fact that the rates of consumption of Coca-Cola and their sugary drinks have gone down a little bit. And I think there's some truth to that. But the fact of the matter is the overall level of consumption is so far off the charts that we're not going to get out of the healthcare crisis that we're in unless there's a dramatic drop. And they're not interested in a dramatic drop.
Well, I want to get in a couple of more questions before we run out of time. So here's a pretty quick one, hopefully. I'll start with you, Jen. When a local soda tax is passed, like we saw in Berkeley, what happened to soda drink sales in the surrounding areas? Did we just shift the market to Oakland and El Cerrito, or did it really stay in Berkeley?
That's a really good question. So we did research assessing consumption of sugary drinks in Berkeley, but another team looked at supermarket sales in Berkeley versus surrounding areas. And they also saw a reduction in sales of sugary drinks. They did see a small uptick in nearby cities. So there might have been some degree of cross-border shopping, but it was also one of the hottest years on record. There might have also been secular increases in beverage purchasing overall. And Philadelphia is another example where sales data was used to evaluate the impact of that tax. And there was some cross-border shopping to try to avoid any higher prices, but still, even taking that into account, the sales of sugary drinks dropped by 38%, and that's a net drop, already taking into account cross-border shopping. So it can happen. And one thing that's really interesting is, having a statewide sugary drink tax would help avoid that situation. And it would also probably make local retailers who are near the border of another city much happier. We've done some research with retailers to understand what are their perceptions of sugary drink taxes. And the small retailers say that they would support it if it was on a broader geographic region, especially the ones that are on the border.
Yeah. Richard, do you have anything to add about that? The trade-offs
No.
between state versus local? Okay. Well, then let me skip to a question about how do you respond to the charge that California already taxes people too much, and this would be just one more. Sorry.
Sorry, I had
Yeah.
a brief interruption.
So is there any way to kind of combat that argument that we're already overtaxed?
I missed your question.
Sorry, there's a sentiment that we're already overtaxed in California, and this is yet another one to worry about. So is there any way to address that concern with any tax that we pass?
Well, that's the argument that's made against taxes in general, and every time you propose something new, that argument comes back. In fact, in the United States, we're amongst the lowest of overall taxes amongst industrialized nations. And you have to consider particularly taxes like the proposed soda tax in context. When we think about the billions and billions of dollars of healthcare costs that we all bear in our insurance rates, in funding Medi-Cal and funding Medicare, these are a drag on our economy, aside from the misery and the shortened lifespans that come along with them. And so it's worth it to spend some money to have an outcome that lowers our overall costs. And we know that if we do good prevention work, and we know how to do this, it's not a secret, but if we do good prevention work, that it leads to healthier outcomes. Healthier outcomes mean lower healthcare expenditures.
Okay, that brings us to our final question. And I'll start with you, Jen. What else can governments and institutions do along with soda taxes to reduce sugary drink consumption beyond passing taxes?
That's a great question. One policy approach, which also borrows from the tobacco experience, is using warning labels for sugar-sweetened beverages. And experimental work in the US has shown that this is effective at decreasing intentions to consume sugary drinks or even selection of these drinks. And the country of Chile actually implemented front-of-package warning labels for products that are high in added sugar. And that law, together with some other components of it that restrict advertising to kids, has resulted in a 24% drop in sales of sugary drinks in that country. So that is another evidence-based policy that is emerging, or there's beginning to be evidence for it. And then what institutions can do is follow the example of UCSF and other health systems. So UCSF implemented a workplace sales ban on sugary drinks. And that resulted, together with a brief motivational intervention, resulted in about a 50% drop in consumption of sugary drinks among employees. And that drop in consumption was also related to improvements in insulin sensitivity, as well as waist circumference.
Wow, thank you.
Yeah, that was a remarkable study. It was completed recently, and it's led me to start discussions with some of my local healthcare institutions to see if they wouldn't consider voluntarily eliminating sugary beverages. I mean, imagine going, I'm not going to name names, but in my district is one of the largest hospitals, the largest hospital institution west of the Mississippi River. And they have a cafe that's run by the hospital. I'm not even talking about Starbucks, where you find lots of sugary beverages, but they've got a cafe where you can go and, you know, buy as much soda as you want, you know, next to people who are in the hospital suffering from if we were to be able to clear the hospitals of all people who are suffering from diseases that are secondary to soda consumptions, we wouldn't find too many people in the hospital. But there are other things that we can try, and they've been proposed in the legislature. Limiting cup sizes. You know, do we really need 32-ounce drinks in our fast food restaurants, or not allowing for free refills? You know, maybe that would help. Limiting displays so that you're not having displays that create impulse buying desires for soda as you're in the checkout line. These are all things that have been proposed. They've been tried, and they've failed in the legislature because of the money that is spent to oppose them. And speaking of money that's spent, the soda industry and this coalition contribute enormous amounts of money. I'm not talking about the marketing campaigns that they do. I'm talking about campaign contributions to people like myself. I don't accept them from the soda industry, but many of my colleagues do. That's another form of dependence that makes it difficult to get things done in Sacramento.
Okay, well, speaking of which, we are at time, but I want to ask you one last quick question. It's not a quick question, but you'll have to be succinct. And that is, what can our audience, who are members of the general public, do to support your efforts to pass a statewide soda tax? Concrete.
Well,
yep.
Stay engaged, lobby your individual legislators who do listen to their constituents, make your voices heard, become part of coalitions that support this policy change.
Great. So I want to thank Assemblyman Richard Bloom for joining us today, as well as Professor Jennifer Dalby for her insight and expertise. And I'd like to thank all of the Robert Mondavi Institute and UC Davis Library staff who organized this evening's program. It's been fantastic. And finally, thank all of you for attending. We will post a recording of this event in a few days so you can share it with your family, friends, colleagues who may be interested or couldn't make it tonight. And we hope to see you at future Savor events, either virtual like today or when circumstances permit, back on campus at UC Davis. We look forward to exploring other important food and beverage topics with you, such as our fall program on winemaking and climate change. So please take a moment to leave feedback or suggestions for future events in our brief survey as you log off. And good night and thank you.
Thank you very much.